Hey, Dr. Berg here. In this video, we're going to talk about blood sugars. Okay? Very, very, very important, yet very misunderstood. If you have diabetes, if you have hypoglycemia, which is low blood sugar, if you're concerned about preventing those, you want to watch this video. Now, here's how it works. The law of the body is that no matter what, the body must maintain a certain level of sugar in the blood. Okay, so the blood sugar level, we'll call it glucose level, should always be right around 100. Now, if you want to know the units, I think it's milligrams per deciliter, but don't worry about that. But there's blood testing units that you can test your blood, and it should be right here. Now, it does range between 80 and 110, but if that blood sugar goes too high, okay, that's called hyperglycemia. That means that's diabetes. Okay? If the blood sugar is too low, that is called hypoglycemia. Okay? So the goal for the body is to maintain a blood sugar of 100. So it'll do everything. It'll tear the body apart. It'll break down your muscle protein with one goal is to maintain normal blood sugar. So almost everything you eat eventually breaks down into glucose or sugar, okay? Even foods that are not sugar. Even protein and fat will break down, and then you're going to build it, the body will build it back up into sugar. So sugar is used for fuel and nourishment to the cells. So the way it works is this. You have this huge organ here called the liver. The liver is on the right side of your body. It's about 3.5 pounds, the size of a football. And then we have this tiny organ right here, which is called the pancreas. And that's right here, and right below the left rib cage. Now, these two organs reciprocate, and what I mean by that is they have a mutual relationship. They coordinate. They kind of control the blood sugars, okay? But the liver is the most ignored piece of the puzzle in diabetes, which we'll get into, simply because here's how it works. The liver controls blood sugar when you're not eating. And the pancreas controls blood sugars when you eat. All right? And they go back and forth and back and forth. So what the pancreas does is it makes a hormone. It's called insulin. And basically what it does is it gets the sugar out of the blood. Okay, so it takes it out. It reduces blood sugar. Okay, so there's hormones that lower that sugar. All right, that's when you're eating because you just ate and you're flooding the blood with sugar. Even if you don't eat sugar, because everything turns down to sugar eventually. Now, when you're not eating, we need to kind of raise the sugar. So your liver will put sugar into the blood. Okay? So it goes in. All right? So, and it does it through a hormone that's very similar to insulin, but it does the opposite. And they call that insulin-like growth factor. So it's an insulin-like hormone, but IGF, but don't even worry about that right now. Just realize there's a hormone that basically, and where it gets the sugar is it gets the sugar from two sources. One is the muscle and the liver, okay? And that's basically stored sugar, okay? So in other words, your body has stored sugar. And the word for that is glycogen. That's basically a bunch of sugars that's stored in the body so you can use it fast, okay? And it also gets it from fat, all right? So those are the two sources that you're tapping into. So obviously that's the goal, is to be able to lose fat or tap into fat, but that's the purpose of fat, is to act as a storage so you can use it when you're not eating, okay, or starving, or exercising, or fasting, those things. So the liver basically takes that fat and it converts it into sugar, and it puts all the sugar back in the blood to keep that 100. But first it goes after the stored sugar. So this is number one, and this is number 2. So in the presence of any stored sugar or any sugar at all, this fat will not be used at all. The body does not like to burn fat in normal situations unless there's no sugar there, okay? So the way it works simply is the pancreas regulates sugar, it pulls sugar out when you're eating, and then when you're not eating, the liver starts kicking in there and puts the sugar back in and starts to take this storage and start to put it back in the blood to maintain a sugar at 100.